हाँ हाँ, सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
आई सॉ रहे तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे, डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. Skin is the largest organ outside our body, and its main function is to protect us. Sometimes this protector also needs protection, especially when seasonal skin allergies come into picture. Let's talk about seasonal skin allergies in today's Apollo 24/7 Health Hour, where we've invited Apollo's expert dermatologist, Dr. Ravichandran Ji. Join us 11 a.m. today and ask all your questions about skin allergies. And do not forget, there's a health quiz waiting for you, and you can win prizes from Apollo 24/7 as well. See you there in a short while.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 and 30,000 health professionals listening. 2. Advice. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Good morning, namaste, namaskar, and welcome to Apollo 24/7's Health Hour. Every Sunday, we bring you an Apollo expert to this live show where you can ask questions and we shall get answers for your queries. And today we are talking about seasonal skin allergies. Please go ahead. I see that a lot of people already have joined and they have asked their questions. May I request you all to type your questions in YouTube chat box only, wherever you're watching this, on Facebook or any other platform that you're watching this on. But if you want your query to be answered, go ahead and ask your question in the YouTube chat box. And while you're typing your query, may I request you to type in all the details possible in one question itself, like all the age, your treatment, your question, gender, everything into one question will help me to scout through the questions. A lot of questions that I see. And today we have a very eminent expert, Dr. Ravi Chandran Ji, who's a senior consult dermatology and dermatologic surgeon, who's going to join us in a few minutes. So go ahead and ask your questions on the chat box. Also, there's a health quiz coming up. We are going to give away discount vouchers and coupons, and wait for them towards the end of the show. Let me start the show by talking about this wonderful initiative by Apollo 24/7 and Apollo Foundation, which is called SACHI. This SACHI is called Saving a Child's Health Initiative. In association with Apollo 24/7, SACHI is on a mission to make quality healthcare accessible to children who are underprivileged at no cost. Yes, you have heard it right. No charge here. If you know somebody who's an underprivileged child, you can take care of them by passing on this message. Scan the QR code to know more, because more than 10 plus pediatric specialties from Apollo pediatricians, renowned pediatricians, are there in the part of this team. So go ahead and ask all and share the good information. Now let me invite Dr. Ravi Chandran, who's a senior consultant dermatology and dermatologic surgeon at Apollo Hospitals, Greens Road, Chennai. And he's a very, very experienced doctor with 23 years of his service. He has held workshops in dermatosurgery for dermatologists and many CMEs. He is an examiner for fellowship in dermatosurgery, Bangalore Medical College and Rajiv Gandhi Medical University. He has published in various national and international journals, who has a co-author dermatology chapters he has undertaken at Apollo Textbook of Medicine. It's a pleasure and honor of having Dr. Ravi Chandran Ji here on the show. Namaste, Doctor. Welcome.
Namaste. Good morning to all the people, viewers. I'm very happy to be here today, and thank you so much for your kind introduction, Jansi. Thank you.
Thank you so much, sir. It's a pleasure having you here. Doctor, I know that you have been spreading awareness. You are always trying to reach out in multiple platforms. You're spreading awareness and taking medicine to remote areas also. So I want to understand vitiligo, as Vitiligo Awareness Day is coming up on June 25th. What kind of newer technology and all has come up in vitiligo treatment?
Thank you. Before we begin, we just wanted to explain what is vitiligo. Vitiligo, otherwise called leukoderma. What's happening there? The skin color goes away. We have a small cell called melanocytes, which produce brown pigmentation. See, if it is lost, you get a small white patches. It can occur on any part of the body, particularly over the face, over the hands, over the body. So it has got a lot of classification. We have 4 different types are there. We have the lips and tips can be called lip tip vitiligo, segmental vitiligo, focal vitiligo, and vitiligo involving all over the body. And sometimes the hairs which are there in the scalp and the body also can become white. So this is the cause, the vitiligo. Cause for this vitiligo is generally unknown, but we know now that it is due to an autoimmune process. It can be associated with other autoimmune diseases like thyroid disease, diabetes. It is very rarely, but the incidence of genetic transmission is very low penetrant. So nothing to be worried about this condition. So the vitiligo, what is the cause of vitiligo? I told you, but what impact it causes in the individuals who are with this disease? It causes so much of psychosocial inhibition and low self-esteem. So we have to be very clear and understanding this concept of vitiligo. So we look into this topic as
yes,
it is
doctor,
go.
definitely. Yes, a lot of people who are asking about leukoderma and vitiligo as well. So we will come back to the treatment, because I wanted to ask this question as the Vitiligo Awareness Day is coming up. And also, seasonal skin allergies. Ask me about this. Now that entire summer season, we had one kind of rash, we had different kinds of issues with redness and other fungal infections. Now monsoon is coming up, again fungal infections can be out. What are the seasonal skin allergies that you've been observing in your clinic, doctor?
Yes, allergy. I mean, what does allergy denotes? Allergy denotes that there's a kind of uh, untoward reaction to certain many things in life. So we live in an environment. My professors always tells us that anything under the sun, including the sun, can be the reason for your allergy. So generally, patients do come to us and say, "Doctor, I have an allergy." But it's a broad term, but we classify allergy into different aspects. As you correctly said, skin allergies can happen during seasons, or it can also be related to the body constitutions. Sometimes we talk about a condition called atopy. Patients are having increased IgE level. They have a severe itching called the atopic dermatitis, which is commonly associated with asthma, sneezing, and wheezing called allergic rhinitis. This can run in family. So one important aspect of skin allergy is whether the patient is from a atopic diathesis. So where the skin is also involved. So we look into that small infantile children and adult phase of atopic dermatitis. The itch scratch cycle is the most common factor. Any allergic reactions, what is the primary symptom? The patients have itch. Though itch is a very pleasurable sensation, but it cannot be, because it can really cause so much of disturbance into day-to-day life. It can also disturb the night sleep, so that quality of life in these patients can suffer. So we need to identify what is the cause for allergy. But we talk about allergy part, where the commonest allergy we see is urticaria or hives or nettle rash. It comes most of the time as an acute urticaria or chronic urticaria. Anything which is less than 6 weeks is called acute. More than 6 weeks, we call them chronic urticaria.
Right.
What do you see in
Right.
urticaria? Red itchy swellings, like mosquito bites or caterpillar bites. People get these kind of reactions all over the body. Lips can get swollen, eyelids can get swollen, drugs can cause allergy, hair color can cause allergy. There are lots of factors, but I will explain to you as and when the questions do come.
Sure, thank you. And while we're talking about urticaria, I'm a person who suffered from stress-induced area for a very long time. And then when COVID had come, I again suffered from hives and rashes while in COVID to an extent. So is this common? What kind of cases have you seen in COVID?
Yes, very good question. Because the last 2 years, during the first and the second wave, we have seen quite a number of patients complaining about these hives. Extensive one, difficult to treat urticaria. Particularly, I got my first encounter with COVID. One of my friend's daughter had severe allergy in overnight during the first wave. I never knew that it was due to urticaria, so food allergies. So next day, all the people at home developed fever, cough, cold, all tested positive. So then we all came to know that this was happening the first week of first wave. So urticaria is a common presentation. It can be a post-COVID urticaria. It can follow after a kind of a COVID vaccination. If the particularly patients who have a tendency to hives, get hives called atopy. So this is a topic which please address it to a dermatologist. Now we are very comfortable that we don't see many patients who are following the fourth wave or the third wave. This is a very interesting, and we have a good answer. We have anti-allergic treatment modalities available to treat these conditions.
How about people who suffered from these hives after vaccination, doctor? They that's also a population, right?
Yes, whenever guideline says that whenever you want to take any kind of action in the world, they always ask for any history of allergy particularly to medication or allergy to previous vaccinations. So what is happening here in patients who have chronic urticaria, this can flare up. That is why we talk about chronic spontaneous urticaria. When after COVID vaccination, day or two, the same day, they will have exacerbation of the pre-existing hives. So we do, but it is self-limiting, and it have to be treated with a good amount of anti-allergic they do very, very well. Only reassurance is very important. Anaphylaxis is not generally common chronic spontaneous urticaria. So we always keep a small emergency injections when the patient develops severe allergy, including respiratory symptoms.
All right. So before you continue, I would want to make a small request to all the audience who are watching this show. I'll be taking up your questions in a while. Kindly, please wait for your turn and do not ask your question multiple times. It makes difficult for me to read multiple times question. अगर appear होता है दूसरे का question समझ में नहीं आता. Thank you. Please wait in patience. We will take your questions in short. So, Doctor, thank you so much. Sorry for the interruption. And next question I want to ask about is about hair fall. I see that a lot of people are asking about dandruff, seborrheic dermatitis, scalp thinning, itching in hair fall since last 4. Pavan Khurana ji ka question I'll start off with. Sir, myself Pavan Khurana, 51 years. I've been facing hair fall since 4 to 5 years. Can mint top forte help to restore hair? And also somebody is asked about itchy scalp and then seborrheic dermatitis in scalp and hair fall. Also, let's talk about COVID and hair fall.
That's very nice. So hair is one of the important organ for us, no? It's though it was called as a vestigial structure in the evolution of mankind, but no, the industry, hair industry, $1 billion have been spent on the maintenance of this hair. Which is more or less a dead structure called a fibrous protein. But the root of the hair is the most active, like your bone marrow or a gastrointestinal tract. It divides every day, pushes up a new amount of keratin called the protein, which forms the nice black hair. It is also cause a kind of a pigments called the black hair. Depending upon the amount of pigments, we have the classical terminal hair. Hair fall, hair go through into 3 phases: growing phase, resting phase, and shedding phase. See, what is happening most of the time, women come to us that doctor, I'm losing so much hair, I'm just keeping it in a small plastic bag container. So much, doctor, balls of hair comes everywhere. It is there in the pillow, it is there in the wash area, it is there in the food particles. So that shows there's a condition called the patient is going through a phase of a hair shedding cycle called telogen effluvium. What is the best treatment? Reassurance. Hey, nothing to worry. Just relax and everything will be reversed back. But in certain situations, we need to identify, is there any existing associated cause? What are the common causes? Stress, as you correctly said, stress can cause so much of hair loss. Any kind of infections, we are talking about COVID recent past. COVID-induced hair fall is very, very common during the first and the second wave. Most of them are self-limiting. Reassurance, identify any associated vitamin deficiency, stress factor, anxiety. Anxiety was so much high during the COVID times. So that's what most of the patients we have seen in 3 to 6 months recovered very, very well. If associated anemia is the commonest condition in women, low hemoglobin. The doctor, my hemoglobin is very nice, doctor. It is 11 grams, 12 grams, but we check the serum ferritin is low. And they may not know that they have a subtle, subdued thyroid profile, thyroid function disorder, thyroid disorder. So we need to look into the thyroid test, then the hemoglobin, the serum ferritin, any focal infections, anxiety, stress. Crash diet. No? Nowadays, people started losing lots of weight. Crash diet, that also causes hair fall. Sometimes we talk about as the one gentleman has asked about the usage of mint top in these patients times. So that's what most of the patients who we have seen in 3 to 6 months recovered very, very well. If associated anemia is the commonest condition in women, low hemoglobin. The doctor, my hemoglobin is very nice, doctor. It is 11 grams, 12 grams, but we check the serum ferritin is very, very low. And they may not know that they have a subtle, subdued thyroid profile, thyroid function disorder, thyroid disorder. So we need to look into the thyroid test, then the hemoglobin, the serum ferritin, any focal infections, anxiety, stress. Crash diet. No? Nowadays, people started losing lots of weight. Crash diet, that also causes hair fall. Sometimes we talk about, as the one gentleman has asked about the usage of mint top in these patients. Hair fall. Sometimes we talk about, as the one gentleman has asked about the usage of mint top in these patients, minoxidil, which
Yes,
came as a
doctor.
serendipitous diagnosis. It was given as a oral tablet for hypertension, blood pressure management, but it was a chance discovery. But we classify hair loss into generalized, diffuse, or localized. Then we have the pattern alopecia. I think Shanku must be suffering from a male pattern illness called androgenetic alopecia, which can affect young men and women. So that is called female pattern hair loss. And men, actually, they have a frontal, temporal, sometimes they can really go bald. So that is one thing which is also genetically transmitted. We will identify them, easily treatable. We have topical solutions, topical anti-hormones are there. Then we have oral tablets are available. If it is, it hair fall in these patients do excess fall because of the associated scalp pruritus, as you correctly John mentioned about dandruff. Dandruff also causes hair fall because they have inflammation in the hair root, which is caused by a fungal spore called Propionibacterium ovale. So that is why all the anti-dandruff shampoo have got an antifungal agent, which has to be used for longer agents. It can be also associated with seborrheic dermatitis for young boys and teens with little acne on their face.
So Devdas Mishra, I think your question is answered. He's 26-year-old and his problem is dandruff and hair fall. So I think he does. When does one need to consult a dermatologist? When do you think it is very severe? Do over-the-counter medications help here? The shampoos that have all these dandruff control shampoos and all.
Yeah, first assessment is important because over-the-counter may not help. Actually, we need to address this. The patients do have to come to us, and then we look into that. We look at the scalp condition, the amount of sebum, amount of dandruff, as well as the inflammation. These patients do have a lot of itching on the scalp, sensitive scalp, itchy scalp, and 2% of these antifungal shampoos have to be used twice a week for quite some amount of time, years and months sometimes. Along with that, if there is associated male pattern or female pattern hair loss, then we give you minoxidil preparation so that it is easily been covered, but it has to be treated minimum period of 2 years. So you can't just, generally what happens, do patients come to us and they want a quick results, I tell them that it is going to take time. You have to continue with this medication for a period of long years.
Okay, doctor, thank you so much. Now, next question I want to take up is a young child's question. Mayur Rank is asking, son is 6.5, 6.5-year-old, has atopic dermatitis, and also going down, I saw a lot of parents asking about 3-year-old children having rashes, red and itchy skin. Is it common in children to have certain skin allergies or showing up on skin?
Yes, we were discussing about that atopic allergy. No, I mean, we talked about allergy called atopic dermatitis, called eczema, or kind of a flare-ups, which is commonly seen in the infant, childhood, adult phase. So 3 categories are there. It got a severe itchy, scaly, red rash over the neck, armpits, arms, everywhere. So there's always, it has been triggered by some seasonal reactions like intense cold climate or intense sweating during the summer months. The allergy can really worsen. This is very difficult to see the small children and babies scratching 24/7. The parent, particularly the mother, is totally drained physically and emotionally. That we classify this atopic dermatitis into mild, moderate, and severe. Depending upon that, the chief anchor of treatment is moisturizer. Very important that we have to use a kind of a good liberal use of moisturizers. Those days we used to apply in the home remedies like oil applications. That might help you to hydrate the skin. And then cold compresses with a little towel with dipped in cold water. We can do a small sponging. That is also a very useful technique. We have to give some anti-allergic syrups or tablets called antihistamines, and topical emollients, topical steroids, and topical tacrolimus. And please do not neglect, because the quality of the school children gets loss of school study hours, and it's uncomfortable. It gets secondarily infected, a lot of pus formation, oozing starts. Then we need to give a lot of antibiotics, topical and oral. Please, if it's mild, we can manage. If it's mild to moderate, then we have good option. Recent advances have come with biologics, and it's a very wonderful the therapeutic has come back to us in the recent times to treat moderate to severe atopic dermatitis.
Right. So next question is I'm going to ask is about pigmentation, doctor. Rajni Mishra, Ritika Pandey, Prem, all these are asking about pigmentation. Also KMM, you're also asking about pigmentation. And how will it go? What kind of creams do you suggest? All the patches about somebody in Telugu, it's called Mangu. Somebody is also asking about that. So can you please
Yes. Skin produces a kind of a pigmentation depending upon the classification. We have Fitzpatrick type. Actually, melanin is a very protective substance. It protects us from the harmful effects of radiation and other factors. But we talk about pigmentation disorders into two aspects: hyperpigmentation and hypopigmentation. That means excess color and low color. So that results in a kind of a different color matching technique, outlook. So the commonest condition for pigmentation, in particularly in middle-aged men, women, is called the melasma. I will take up melasma. It is called mangu in languages like Tamil or Telugu. It is usually seen on the cheeks of the women. It is related to the hormone change related to some thyroid disease. And the one important factor is the sunlight exposure. India is a tropical country where so much of sun is involved. No, we go out and all, we work, we go for a walk. So that causes. So that's one triggering factor. Hormone change. Sometimes it can, we call this as mask of pregnancy. Even after childbirth, women do develop pigmentation, brownish pigmentation on the cheeks, called the malar area. We need to pick it up early so that we'll be able to remove the pigments and make sure that they continue to use the sunscreen lifetime. Very important. Outdoor activities, sitting in front of the system, using a lot of mobile applications. All these affected individuals have to require a sunscreen usage. And two, of course, we have an anti-melasma topical cream, which are very, very effective. Lasers are also available. That's regarding. Another common factor of pigmentation is acne. Pimples can leave lots of brown dark spots. Post-acne pigmentation is the most difficult topic for us as well as to the affected girls and boys. Now, it takes a lot of time to go. So how to reduce this? We need to treat acne very, very well. So make sure no more pimples do come on the face. And I will talk up the topic of acne and how to approach this topic at a subsequent time.
Yes, doctor. Yes, doctor. Thank you so much for talking about pigmentation. Now, I would want to ask a question about seniors. There are two questions. Akshay is asking about his father, 62-year-old. Past 1 year, he's facing white dots or small white patches, which starts from shoulders, increases from shoulders to downwards. Is this vitiligo or is this something else, doctor?
No, this is a very interesting that definitely we can share the photograph. I'll be able to make a diagnosis. We call this as guttate hypomelanosis. What is happening, like graying of hair, the skin also grays. Tiny dots there in the legs, in the back. It generally doesn't become large patch like vitiligo or leukoderma. Only reassurance, there is no need to get alarmed or no need for any active treatment.
Yes,
guttate
thank you, doctor.
hypomelanosis.
Yeah. Rajiv Narayan Saxena's question. My father's aged 84, has itching on whole body. Please guide. Janani Srinivasan's mother is 69. She has inflammation on her left shoulder since last 3 months. Now she's suffering from itching all over the body. Both of them are seniors in question here. Is it different? Like how you said, children have a different kind of condition than dermatitis. Seniors, do they also have a condition like this?
Yes, elders who develop kind of a generalized itch, all over the body, but obvious without any skin lesions, we classify them under a category called pruritus. That means they keep on scratching, but they don't see any rash. That is very commonly seen in elders. What are the common causes of this generalized pruritus? Underlying disorders like diabetes can present with severe itching. You keep on scratching, but you don't see any rash. So the diabetes, thyroid disorders, anemia, hemoglobin, low hemoglobin in elders is very commonly seen. Yeah, this is a very common B12 deficiency, anemia, low hemoglobin, low iron. These are the factors which always, sometimes age-related conditions one need to look. And there are conditions like the dry skin called the xerosis, called ichthyosis or fish-like skin. They are also likely to develop lot of scratching. So that's particularly triggered during winter climate. So if it's pretty
Exactly.
cold season, particularly in North India, when people live, they have to maintain their quality of skin by applying a kind of an emollient, taking a soft, super fatted soaps when you take shower, apply a good kind of a moisturizing lotions, emollients, and give a small antihistamine at bedtime, convenient one which does not cause drowsiness. Many of the antihistamines can cause sleepy state. So one are very careful, particularly if the elders can't able to walk. So this is a very interesting topic, that because safety of medication, particularly in elderly, is very, very common. Please do consult a qualified dermatologist.
Wonderful, doctor. It's a very important point which we might tend to ignore, but commonly found mistake that we do at our end. So thank you so much for throwing light on it. So next question I'm going to ask is, a lot of people who are asking, Subramaniam, Vishal, everybody is asking about itching in parts. How do I've been using powders, over-the-counter lotions, everything, but it comes back. Vishal is also asking, I'm 25, suffering from jock itch from past 8 months, and condition improves after using cream, which comes back. So it comes back as something that recurrent infection. How do we treat this, especially in the genitals and the private parts?
Yeah, this is a very burning topic in all over across India. Our association is trying to fight out this recurrent, because it's a recalcitrant fungal infections called the ringworm infection, which spreads from one part of the body to the other part of the body. It's commonly seen called the jog itch or in the groin area, round circle patch with a lot of itching. Generally, individuals go to the nearby pharmacy counter sale. They use kind of a products which have got topical steroids associations. They get immediate relief because antifungal topical steroid combination the pharmacy fellow gives you, and you apply your doctor. Fantastic! I don't have to go to your doctor, but she lands up with us again with an extensive spread of the lesions, and that is the reason for our recalcitrant dermatophytosis, because inadvertent use of topical antifungal with the topical steroid was there everywhere across India. Now we are facing a resistant dermatophytosis called tinea cruris, tinea carposis, called dermatophytosis. It has to be addressed. Clinical lesion is very important to be seen, and it can affect any part of the body. Nails can get affected, hair can get affected in children, and it causes so much. It spreads to other family members. Particularly, you are just telling that it can come from a school hostel. It can come from some areas where they come and the children have no facility to wash their clothes, dry their clothes, and keeping a personal hygiene is not possible in certain situations like school hostel or college hostel. The children come home and for holidays and give it to all the family members. So the treatment is very important. Personal hygiene, general hygiene, wash your clothes well, dry it up in hot sun, and use separate clothes and soaps for bathing. And then treat properly with adequate dosage and adequate duration of antifungals, topical as well as oral medication. We are able to achieve very good results. Nowadays, we have seen a little bit of resistance to this. Some of the fungal elements have become resistant to some of the medication. That is called the resistant to drugs. So that's why we address some other medication now. We are able to get a good. So please reach to your nearby dermatologist, and it has to be a minimum 2 months course of an oral tablets as well as topical creams for this condition.
Done. So, Vishaka, your question, your husband's question is also, I suppose, answered here. She was asking, can ringworm occur on chest as well? Is it only on parts?
It
So he
does-
has recurrent.
Yes, recurrent.
Does it spread?
Yeah, it can spread because you start scratching, take the spores of the fungus, lodge it here and there on the scalp, on the face, and the chin. And this is the we used to call those days the Dobie's itch. I don't know. I must
Correct. It used to be. Correct. All right. One question, I don't think it's pertaining to us, but the person is repeatedly asking, I suppose, must be stressed out to have Bhat Singh. Does migraine cause leprosy? Migraine disease caused during leprosy reason? I'm not sure if he's asking if migraine causes leprosy or leprosy causes migraine. His question is not clear. But is there an interlink between leprosy and migraine, doctor?
No, I don't think so. Leprosy is totally a different skin conditions, which is caused Hansen's disease, which is caused by a mycobacterium, which has been eradicated so well by the WHO treatment. So we do see some stray cases coming, the new ones, but the migraine is totally a kind of a different headache-related neurologist complaint. So please go to your neurologist. And leprosy appears as a form of a white patches, less discoloration. They lose sensation when you take a feather or a pin. They don't have a sensation. Please don't self-diagnosis of Hansen's disease or leprosy should be made. It has to be clearly seen and discussed and treated. Nowadays, we have very good treatment options for leprosy.
Great, doctor. Thank you. Now, Renu Mehra is asking, brother is 26-year-old, has allergy like small erythema in his hands and legs only. When he visits a government hospital, I don't know what the logic and reason behind it. That means if he visits a hospital, that's where he's getting it from. Only that place. And also somebody is mentioned eczema in hands and somebody right behind my knees. I'll get the names in a while, but eczema or these red rashes, are these two different things? Am I asking two questions in one question?
Yes, any kind of rash on the skin will cause redness, called the erythema. And if it is confining to hand, it is called hand dermatitis or hand eczema. In the last 2 years, we have been asked to use hand sanitizer. So many of us have been using hand sanitizer. It causes the dryness and the barrier function. Skin has got a protective layer which has been disturbed so that anything can become allergic to them. So that is one condition where you need to be careful about using your hand sanitizer. Use a liberal use of moisturizer. And very commonly seen in women who've been working at home, called the dishwasher's hand, the poor mother's hand. We always see the typical burning, irritation, fissuring, bleeding, uncomfortable with a secondary bacterial infection. Hand dermatitis is a cumulative insult dermatitis. Typical many factors. Your water becomes an allergy. And then the soaps, the food items, the handling, it becomes so difficult for our women or men to work in the environment. So hand eczema decreases the quality of life. They suffers a lot, and it can easily be treated very well.
Wonderful, doctor. Thank you so much for that reassurance. Now, I would want to ask for Farhan Alam's question. Doctor, there is a red dotted small plump-like patches on the thigh of my newborn baby, 2 months old.
It's large like a cherry fruit. Hemangioma we call this as, or hemangioma, strawberry fruit like. It's a self-limiting disease. It's a hemangioma. It's a tumor benign condition of the blood vessels. And please reach out to a pediatrician or a dermatologist. They will reassure you. From the description, what you say, it should be a condition called hemangioma, called small blood vessels proliferation. It's a benign, it's very nothing to be worried. We can reassure you from a distance.
Great. So, yeah, next question is about, let me taking questions about vitiligo, doctor. A lot of questions have been asked here. Kameshwari is asking, 5-year-old daughter has vitiligo in the scalp. What care do I need to? So, vitiligo can be seen in children as well. Like, what age can it start?
Yes, as I told you, vitiligo is a deep pigmentary disorder. That means there is no color in the skin. The skin disappears in patches and large areas. Can occur in the lips, fingertips, face, everywhere, including the scalp head, including the scalp skin. I would like to ask this lady, person who wanted to see the 5-year-old daughter, make sure the hairs are white. Just look down at the skin of the hair. Below that, if the skin also becomes little white in color, that means the skin patches as well as the hair root which become white in color. This can happen. This is called this as childhood vitiligo. It can be there on the scalp, and childhood vitiligo can easily be condition, but it has to be it has got a good treatment options are available, because it causes a little kind of, I told you, psychosocial, or maybe the mothers are very upset, or sometimes women come and cry, doctor, how can my daughter become all right? So if it is vitiligo is seen on the sun in exposed sites, it causes a lot of cosmetic disfigurement, low self-esteem.
Right.
So for that purpose, please reach to a qualified doctor consultants, and we can more or less control the disease spread, as well as bring back the lost color called the repigmentation. Treatment is available.
Right. Right. Doctor, while you're talking about treatment options, Mr. Amit Kumar is 37-year-old. He's asking this question. Suffering from vitiligo from 8 years, and also type 1 diabetes. So he's asking, what are the new modes of treatments, or what can he, like how we've been talking, you are the dermatologic surgeon in Apollo hospitals in entire India. So can we now talk about the new age surgical procedures that you've been working on, doctor?
Yes, the gentleman has been okay. He's got a diabetic. He's got the extent of the patches. Is it small area, one or two patches in the body, or it is there in the face, or it is there only in the fingertips? As I told you, we have focal, generalized, segmental, and acrofacial lip vitiligo. When we do that, some vitiligo may not be able to get the pigments back. So we give topical and systemic. And those patients, individuals who get these patches on the face or one half of the part of the body, and if it is not spreading, if you see a small brown spots at the edges, then it's resistant to treatment with topical phototherapy. So many advances must have all of us are giving across India. But the resistant patches, if it is not becoming all right, we are not able to get back the pigmentation. We do a small procedure for small patches, particular segment vitiligo occurs on the face, melanocyte, keratinocyte cell suspension. That's the new technique all over India, across India. Our association has spread this new technique across all medical colleges. We call this as NCS, non-cellular, non-culture cellular suspension technique, which is very effective, very simple. The reason for this procedure is because it gives you very good color matching, good textural quality without any kind of a textural alteration, uniform, smooth pigmentation. That the individuals who go through this procedure will say that, doctor, the patch was not seen at all, doctor. There is no evidence of a skin grafting you are done. And such an excellent result we always achieve in certain areas, but it cannot be done for all the patches. Generalized vitiligo, it can be only done for small patches, small segmental vitiligo, which is not responding to medical therapy.
Done. So, and where all now that dermatological surgery is available in Apollo hospitals, and you are one of the pioneer in doing this, is it available only in Apollo hospitals, Greens Road, Chennai, or all across?
No, all across. Suppose if you take our network hospitals, I think most of the consultants are now started doing this, and it's there and available in every city. And since I've been doing this work for the last 30 years, I have a good large experience. We have also an association of this vitiligo. We across India. We have a doctors consulting in medical professors, trained people. We have a array of doctors who are delivering a wonderful treatment options for these affected individuals.
Wonderful, doctor. So, black circles, dark circles around the eyes. A lot of people are asking, Neeraj, then Sai Srijan. Many people are asking about dark circles around the eyes. Can this pigmentation be removed, doctor? Can you please help?
Yes, we call this as periorbital melanosis, otherwise called dark circles around eyes. It can, one of the factor is the girls who do come to us, men, women. It can run in families. It can be genetic, or it can be acquired by many factors like ill health, stress, sleep deficit. But generally, it can be also related to a kind of a dark skin around the eyes. There can be wrinkles, there can be fat loss, a shadow effect can exaggerate this dark color, and we try giving assess any associated conditions. We give topicals, we give sunscreens, we have a kind of a UV protected goggles, and then we hydrate the skin if it's a dry skin. Then we give any allergic reactions to hair color or eyebrow pencil or anything can also come add up to that. Eczema can cause a post-inflammatory pigmentation, but we have a topical and systemic treatment. We do see some lasers are very useful in periorbital melanosis.
Done, doctor. Doctor, next question I want to take up is Aditya Jha. Sir, my wife is suffering from pompholic skin problem. We have been treating this from last 5 to 6 years with different medications helping. Please suggest how to cure this disease.
Yes, pompholic is otherwise called sago-grind-like vesicles, blisters which occur on the finger edges and the toes, particularly chiro and propompholics. It's a vesicular eczema that is called allergic reactions to many things. And these individuals generally have an increased sweating in the palms and soles. The one of the called dyshidrosis, disordered sweating. One another factor is contact allergens like which is the caustics, the acids, the alkalis, the food particles can cause any focal infections in the body. Particularly, it can be a reaction to a inflammatory athlete's foot in the feet. You have to look into that. And then any kind of active fungal infections in the body can also have present like an id reaction called allergic reaction. And hand dermatitis also very commonly seen in atopic individuals. So that's why the reason is these dishwashers, so many chemicals allergies, contact allergies. Then the tooth, my professor always say, look for any kind of a dental focal sepsis or sepsis in the ear, nose, throat. So look for any kind of a chronic infections can trigger these active infections, particularly fungal infections in the feet or groin, or drugs can cause pampholics, increased sweating, and then the occupational dermatosis, particularly we use a lot of dishwashers and water. These are the factors, but it can easily be treated well.
Yeah. So here are two questions which where's this question gone? Sorry, doctor. Yeah, Kriti Kumar. Yeah, eczema ke बारे में बात कर लिया. Swapnil Patil. I have bluish green patch on half of the forehead and around the eye growing under the cheeks. It is very prominent when I am in sun. Swapnali Patil has not given her age yet. So I'm understanding that she must be young.
Yes, if it is confining to one half of the face, particularly the forehead and around the eye and the chin, we have, if it is there from the birth, we call this as a birthmark-like condition called nevus of Otto or nevus of Ito. If the nevus of Otto can also involve the iris pigmentation. Look at your white ball of your eye, it can have a small brown bluish pigmentation. It's a completely different condition. If it is nevus of Otto confining to the forehead and other things, we have a very good laser procedure for Q-switched NDAC 2-3 times when we do, and the pigmentation can be worsened. But there are other conditions we do not know what the woman is talking. But please, what is your diagnosis? If you can mention to us, or maybe reach to a nearby dermatologist for it.
All right. So here are questions on acne. While I'm scouting through, I've been writing questions on acne so that all this can be addressed once. Anusha, Shoaib, Deepak, Rahul, Jeevana Jyoti, Musib, everybody, Mao Musib, everybody is asking about acne. One has acne which is persistent, one has started acne after a certain time, one has 16-year-old and acne, somebody has pigmentation, somebody has white heads only on acne, and Musib is having a pimple in different parts of my body which are popping up suddenly and disappearing on their own after a day or two. So let's talk about acne in detail, doctor.
Yes, yes, very common condition which is
Yes.
seen in the pubertal age. We call this as pubertal acne. Acne is derived from a Greek word called acme, mean the prime of life, the youth of life. It is characterized by blackheads, whiteheads, papules, pustules, nodules, cyst and scar and pigmentation, which can occur on the face, chest, arm, and back, called the truncal acne. It can be also associated with dandruff on the scalp. It is due to a hormone factor. It is due to male hormone called androgen. Why, doctor? Male hormone. Women also have androgens from their ovaries. So this is the flare-up. Acne is a good sign of puberty. We always call this as menarche precedes, subarche precedes menarche in girls. So acne is a good sign. That means there's a kind of a hormone change in the system. So what happens here? Sometimes it have a whiteheads like a comedonal acne, very resistant, tough, small black spots, and we have a small typical acne which gets infected. Acne treatment is very good now. We have to be very in this so that minimize the side effects of acne, which can cause pigmentation and scarring. Scarring can be very severe, called ice pick scar. Take an ice cube, put it on the floor. You see the difference of the crystal. So it can be there on the face. So they always say that the facial skin becomes an undulant, very unrough road. So that we have to be very careful. Cause a little low self-esteem in the girls and boys. Can easily be treated. We give topical and oral antibiotics, and we have a oral synthetic retinoids if it's grade 2, grade 4, grade 3, very resistant. And another important factor I want to diet and acne. Very important that the days are there. There's lots of fast food items that's consumed. There's high glycemic intake of food stuffs like sweet, chocolate, cheese. All these things causes excess oil production, and it can also flare up acne. Low fiber, high fiber diet is the best treatment for acne.
Right. Doctor, would you want to have a sip of water? We'll continue talking about acne.
Yes. Yes, you can go.
So any treatment options that you would want to suggest, doctor, when you're okay, doctor? Would you want to take a small break? I can go through, read all the other questions. Please have a sip of water. I know it's quite a long time. So while we're talking about acne also, a lot of people are asking again and again about fungal infections, which I think you should reiterate in a while. Yeah. So, but if you're okay, we'll continue about acne.
Please.
Yeah. So we have, acne.
Acne, please, like to say from my point that it has to be picked up very early. Don't allow it to become larger. And the parent, the elders at home says acne is a common condition. It will go by its own age, but it will cause a lot of damage. Don't allow it to happen, because nowadays we need to cause very important that self-esteem is to be cleared. A very easily treatable condition, we give topical and oral antibiotics, isotretinoids, synthetic oral retinoids, depending upon the condition. And chemical peels are available to reduce the pigmentation and open up the pores of the oil glands. And if there's a kind of excess oil secretion also, they need to keep washing their face 2-3 times a day. Don't use herbal or home remedies. And take care of the dandruff part. Healthy lifestyle. Stress can cause acne. Exam stress, particularly the girls who have a severe exam stress, can flare up acne. And acne scars, and the scars can grow into keloids, particularly keloidal acne in the young men of 20-25 years over the back and chest. Keloid, very difficult condition to treat. That's why begin the treatment at the age of 16, and it continues to get treated till you reach 25 years of age.
Done. So, doctor, a lot of people are again and again asking about tinea corpus, tinea curaris, and also molluscum contagiosum. All these fall into one bracket. So while people, Sailesh and others were asking about ringworm, jock itch, or anything else, would you want to say, if we don't use over-the-counter treatments of steroid creams or whatever, madlams, lotions, what else can they do? What is the protocol that they have to follow?
I told you about maintaining a good general hygiene, the clothes to be properly dried and it should not be wet, and treat all other family members who have these conditions at one go. Give topical antifungal for a period of 2 months. Oral antifungal in the form of itraconazole is the one drug which is very sensitive across India. But why it keeps coming? Because they must have used along with the steroid, with the topical combination of steroids. That causes little kind of long recalcitrant features, and it is easily now comfortably treated. The only one stress point is this personal hygiene. Shower gel, shower use very well, clothes to be worn, cotton wear, all these jogging materials, particularly the plastic one, the kind of one which doesn't absorb sweat, the tight jeans, tight pants, every day clothes to be changed. Loose garments are very, very commonly to be worn. Sport activities are very common area where people develop from one person to another. Washing, even our we always use our theater dresses properly so that it doesn't come from other areas. Once it comes to the family, treat all the family members at a given single time.
All right. So 3 important questions that I would want to take up. One is Mr. Swapnil, I did lose the name again. Too many people are spamming today. So Sandeep Kaur, ma'am, my wife is getting rashes when exposed to cold. In severe cold conditions, she gets red rashes and itch over. Are there people who are sensitive to cold, doctor?
Yes, yes. As in urticaria, we have the cold urticaria, then aquagenic urticaria, cholinergic urticaria, and apart from that, the cold triggers all this kind of a phenomenon. They are comfortable with a dose of oral antihistamines at bedtime. During this time of cold climate, they have to be continuously on a dose of antihistamine. And sometimes I told you solar urticaria. Sun also can cause urticaria. Sun can
Of course,
cause.
somebody was asking about, I wrote the name and I'm sorry, I forgot to mention that question. Somebody has rashes, get out into the sun, 30 minutes of sun exposure, they have red, dark patches coming up.
This is called the UV-induced urticaria photosensitivity. We call this as photodermatitis, and they have to use a good wide, broad-brimmed hat, then avoid perfumes and which attracts the UV radiation, like perfumes and scented ones, and use a kind of sunscreen minimum 30 minutes before they intend to go to the sun, and use it minimum 3 to 4 times a day. It's most important that I'm using sunscreen in the morning and I get this allergy in the evening. That's because it only starts for 4 hours stays. So when you wash your face, you sweat. It has to be repeatedly used. An antihistamine, if there's a kind of a rash, we always give a topical steroid, topical tacrolimus cream. If there's a kind of a breakout on the skin due to bad sun allergy.
Done. So continuing in the same thing, Kirti Kumar said, my eczema, according to my dermatologist, is due to fabric allergy. And hence, as per his advice, I'm wearing only cotton fabric. But I observed that it is also due to dry skin and sweating.
Yes, dry skin has to be managed with a good moisturizing and and then the moisture, of course, the contact allergen to these particular woolen garments can trigger. If they have a small tendency of atopy, they are react to all these things. So you need to check your atopic blood test to identify whether you have increased IgE, but it is not generally correlated. So patients do ask us, doctor, what is all these things? How do I confirm that I have this kind of allergy? We generally ask patients to go for an IgE test. And it is not going to matter to us, but we can tell the patient, a human, you have a lot of allergy in your system called IgE is very much, sometimes it can run to thousands of units. So that means they have a tendency to flare due to many factors. So identify the triggering factor and control these things with a good proper care of an antihistamines and proper care.
Yeah, with this same question, dollar question, Rajak Raj, can food allergies aggravate dermatitis? If yes, how to identify which food is the allergen? So I relate to this question because I went through profiles and profiles and profiles of allergy tests in the beginning. So do you suggest some tests to be done here?
Yes, for atopic children, particularly atopic eczema, food can cause some kind of a reactions, particularly the peanut butter, then the chocolates, sometimes the soft drinks, the coloring agents, preservatives, milk, eggs, egg protein,
lactose, gluten,
lactose, so many things. But all these phenomenon do occur if the children are also have associated wheezing and sneezing and kind of a respiratory allergy. Number two.
okay.
Then the urticaria, which you've been telling, no, generally chronic spontaneous urticaria, we generally don't ask for any kind of an allergen panel test. We have a array of very expensive tests which may not be. They do a small prick test. They give a small injection of your protein or a house dust mite. It doesn't matter much to us. So we always look at any focal infections or any underlying disease. But CSU, chronic spontaneous urticaria, do not need much investigation. They are comfortable with a long-term dose of antihistamines.
Done. So we have left a link to the test which can be ordered on Apollo 24/7. There is some tests that doctor would want to prescribe, and we've also left a link to consult Dr. Ravichandran ji on Apollo 24/7, which will be helpful for a lot of people. Many questions, I know individually I couldn't ask these questions, doctor, but you have given very clear answer to many of the topics which we are talking about. So thank you so much for being with us on this Sunday morning. It was really very informative, and you were very reassuring, I should say. Thank you. And doctor, as we're approaching the World Vitiligo Awareness Day coming up on June 25th, we would want you to give us top tips of identifying and approaching a dermatologist for vitiligo treatment, please.
Very much. We need to support them, no? Those individuals, particularly younger individuals who get this white depigmentation of the skin, the color of the skin goes away. We have to first treatment is supportive, care, and then compassion, and make sure this is not a contagious disease. It doesn't spread to others. And once we reassure the individuals along with the parents, I think we'll be able to, we achieved most of the, then they adhere to a treatment protocol very well. Good treatment options are available. Make sure that we don't get into side effects of the long-term treatment of this vitiligo condition. Newer agents are available, going to be it's in the pipeline that it is going to definitely maybe a game changer in the years to come. And existing treatments also help this individual to get back the pigmentation. If the color of the skin is not achieved, whatever treatment modalities is used, we always resort to a kind of a simple outpatient procedure called melanocyte keratinocyte cell suspension technique, which is a very useful and simple technique without much of pain. It's an outpatient procedure. Please reach out to centers where they do this procedure in stable vitiligo, particularly on the lips, on the face, on the fingertips or body areas. And sometimes the white hairs may not be able to treat it on the scalp skin, so we always use a kind of a hair color or kind of do a hair transplantation, the normal hair. And vitiligo sometimes are not treatable. We need to accept it, realize that this is a diff condition. So once you accept this, though, we always give a kind of a camouflage cream, that means a makeup cream, so that the affected individuals, particularly young individuals who go out to work and they mask this color match is done with a camouflage cream, so that they are very comfortable. They are put into ease, so their self-confidence goes up. Vitiligo is a kind of a treatment condition where it causes so much impact on us. We as dermatologists, trained people across India, have devoted our passion and treatment options for these individuals. And please reach us to us. And this is a condition where it doesn't cause much discomfort, but it causes so much of discomfort in the mind. So mind is to be treated well, psychotherapy has to be reassured, and be positive approach to be given that these individuals can be progress to the normal lifestyle, so that it doesn't go into spread to others and they run so much in the families like a high genetic transmission. It is not there, though it can happen in certain families. So reassurance is World Vitiligo Day is approaching on June 25th across the world. Please go and reach out to our consultant dermatologist. Definitely will help, particularly in the childhood vitiligo. As John C has asked about children with vitiligo, so much care, so much support to be given to the parent. The child may not know what is this condition. The mother weeps inside. So they are relentless sleepless nights. They go through that. When the daughter becomes marriageable age, this can become a hurdle, that we always have a support group and make sure that it is clearly taken into consideration. Thank you so much.
Thank you, doctor. Thank you. One question before you leave. Somebody is very, I think somebody is requesting, Sriram Acharya, 48-year-old, taking medications after surgery, bicolinda left prox tibia. He's undergone the surgery, taking cysts, a lot of, but 15 days, body is itching severely. Little respite with Montec. Can he consult you further, doctor, or does he require a dermatology consult?
We have to identify, no, as I told, we are not looking at this drug-induced allergy part. So that is a big topic. So we'll address it, but we need to see these individuals, what it could be. Is it secondary to any drug therapy treatment, drugs, or anything pre-existing conditions?
Done. So Sri Ramacharya ji, please contact Dr. Ravichandran. Thank you so much, doctor. Thank you so much for being with us on this Sunday morning. And now here's our quiz coming up. You answer your questions in YouTube chat. The questions, winner's name will be announced towards the end of the show. Once you are announced as a winner, please write back to us at marketing@apollo247.com to claim your gift vouchers. All right, here's your quiz on the screen. Is acne a skin allergy? Question number 1. Is acne a skin allergy? 2. When is World Vitiligo Day observed? अभी आपको हाल ही में टिप भी दिया गया था, आने वाला है सामने. Question number 2. When is World Vitiligo Day observed? Question number 3. Whom can you consult on Apollo 24/7 if you need skin surgery? Whom can you consult on Apollo 24/7 if you need skin surgery? Specify the department, not the name of the doctor, but which doctor, which subspecialty can you consult? So these are the 3 questions. Meanwhile, while I'm waiting for your answers and our team selects the winners, here are the coupons that you can use on Apollo 24. First, we see to get up to 150% off on the first online consultation. So doctor consultations direct from Apollo, use it on Apollo 24/7. And if you become a circle member, then even more benefit of using these. All right, the next coupon that we are giving away is first 3, FIRST3. Use this code on Apollo 24/7 to get up to 25% off on online medicine orders. So order medicines direct from Apollo as well. Well, HH247 is for you all who joined us on this Health Hour. This is an exclusive code that we are giving away for our Health Hour viewers. You get up to 199 rupees off on online consultations with Apollo doctors and up to 20% off on medicine orders. So go on, download Apollo 24/7 and use these codes exclusively for Health Hour viewers. Thank you all for joining us, and I'm waiting for our answers. Yes, no, June 25, dermatologist. Wow. Lavanya, Raghubabu, Devika Mondal, Jayashri Gopal Krishnan. Wow, a lot of people are answering today. I'm glad you're answering. And let's see who's going to be our winner this week. And I'm sorry, a lot of people, I couldn't take your questions here because we've been discussing all the same topics. I hope you have found an answer for your query. Well, here are the winners for today. Sona, Kanani, Lavanya, and Vuyuru Raghubabu. Congratulations. I repeat the winners. Sona, Lavanya, and Vuyuru Raghubabu. Congratulations. Please write back to us and claim your gift vouchers from Apollo 24/7. Right, and next week we shall see you with an interesting topic, impact of work stress on mental health. Tune in to our Health Hour 19 June at 11 a.m. If you don't want to miss session, subscribe. And then also there's a bell icon which you can turn on. Notifications will be sent on your phone or email. Thank you so much, all of you, for joining us on today's session on dermatology and skin allergies. Thank you. Thank you once again.